So I think now, since we've already stumbled upon it, let's address the elephant of the room. Like, what are the crazy questions, like myths that people have come to you with? Like, okay, can I try this? Can I try that? Like, apart from your stockings and all of that, which is the truth, like compression socks and all of that. We'll keep that aside. But what other home remedies have people asked you? Can I do this? Can I do that? Like, I have a list. Let me just
Absolutely.
pull it out for you. Yeah, I don't know what of it is the truth. Elevate your legs.
Works temporarily,
Mhm.
but I wouldn't do that to cure varicose veins. Pura khana muh mein aayega aur kuch nahi hoga. I mean, what else will happen? You keep elevating. Was that how you're born? I mean, we're not monkeys, right? So it doesn't work.
Yeah, exercise regularly, walking, cycling, yoga. By improving blood circulation, I can
It does. It does significantly improve you. It makes you feel better. It doesn't cure you, but you are better off as a vascular patient to walk and do yoga than not do it. So yes, it does work.
And the compression stockings, yes. I mean, it's a very management level kind of a remedy. Or is
Yes, compression is purely management. You just press it and leave it for that day, which means if you don't wear it tomorrow, you'll get it back. So it doesn't solve the problem. The origin of compression stock, and I think this is important because where this thought comes from is in US, where there's high insurance penetration. They don't want you to go and get beautification procedures left, right, center. As in, if you have varicose, some women don't like it. They want to wear short clothes and they'll go and get it done.
Oh, it's like a cosmetic.
So to prevent that misuse, they say that everybody has to wear stockings for a while and tell me how you're doing. Write a diary. Come back to us after 3 months. So they won't approve insurance in US for early varicose veins.
Oh.
So that is a challenge. So that's where this compression myth became bigger and bigger. The companies, obviously everybody has to take stockings. So the companies became this mega big companies. So now they push it everywhere. They make it sexy. They'll put flowers. They'll put, all that is fine, but it doesn't work, right? I mean, and then today was 36 degrees outside today in Bangalore.
Oh.
Yeah, imagine wearing that and on top of that you're on clothes and then chadi or whatever. So it's kind of hard.
And walking on Indian roads.
So it's not hard. It's not an easy thing. So stocking has this history that's built into it. And it's very problematic because when I tell patients stocking is not going to work for you, they'll open up some website which is usually run by an American thing and say, my cousin is using it. And it doesn't work in India. So that's the challenge we have.
Thanks for, putting some facts out on the table because we know where this has stemmed from now. Is it true that eating high fiber food can worsen, it can have a bad effect on the varicose veins?
Not related. High fiber food is good for you. It doesn't have any effect on varicose veins.
Reducing salt intake helps prevent swelling?
Yes, helps prevent swelling, and reducing salt intake can also help prevent the pain in the varicose veins that you feel. Because salt keeps water with it. So everything swells up if you drink high.
So reducing the water retention is how you can
get a
feel
little relief.
Okay. Staying well hydrated, will that support the vein health?
Yes.
So how many liters a day?
Well, I don't believe the 5-6 types. I believe thirst based plus maybe a liter. So whatever you're thirsty, drink plus a liter. Liter is for insensible water loss, which means the water that you lose without your knowledge. When you sleep in bed also you lose some water. Right? So all that's called insensible water loss. So insensible water loss should be about 800 ml per day.
Oh yeah.
If you are living in a fairly comfortable life like this. Of course, even hot sun would be different. So it all depends on what you do.
Walking while I'm sleeping.
That's insensible water loss.
All of that is
800 ml to 1000.
So what's with the apple cider vinegar? Does it help with?
It's one of the biggest myths of modern lifestyle. I don't know where it came from. Some guy's written a book. I have not seen it in any journal. It's just a joke. And a number of Instagram. I probably get flamed for saying this, but it doesn't work. It's as simple. Apple cider vinegar never worked. It's just a myth. I'm sorry to say this. It's my view.
Has never worked for any of your health. Benefits.
No. What is it?
Not just varicose.
Nope. My view. I'll keep you out of
it. Of course. Now the next myth is elderly people get varicose veins. I know it's not the...
They do.
Only elderly...
Yes, as you age, you have much higher chance of getting varicose veins. Remember this calf muscle I was talking about?
Right.
That gets very weak as you age.
Mm-hmm.
So you get that just doesn't pump and you get more varicose veins.
So how do I tackle this to stay more active?
More active, yes. More active, walk more. You have to, especially older women, the 60s and 70s ladies, when they were in their 15s and 20s or whatever, nobody told them the importance of exercise and running around. And, the schoolings was also pretty bad those days. So I think they should get this point. They should go for long walks and keep exercising.
So do I need to have more muscles? Does my muscles protect me? Because they say now after 40, right? Muscle is your biggest currency, which will protect your joints and everything. So are you talking from the muscle perspective or just movement perspective?
Muscle and movement and muscle are together. So if you don't move, you don't build the muscle.
I mean, strength training versus cardio? I mean,
both. You require at least 2 cardio sessions and remaining strength training. I mean, I just do cardio. I mean, I take very fast, long walks, but we have enough evidence to say that after 40 years, strength significantly drops. So you should strength train.
Crossing legs, does it cause varicose veins?
It's a commonly held myth. I have not read a book to that effect, but I do see that people complain that they sit cross-legged. More varicose patients complain like that.
Yeah.
So there is some truth to that in experience in real life, but I've not read a book to that effect. I've been reading every book on this, but I've not read a book to that. But there is some truth to that in my experience, at least.
Yes. The next myth is it that only women get this more compared to men, or is that they hide it better? I mean, keeping the pregnancy aside.
No, women do get it more than men, actually.
Why so?
So again, I think the pregnancy one of the aspects. Or to a degree also, I believe in my experience, women come a little earlier in the course of the problem. Women we see more leg pains and cramping and all. So they usually are a little more sensible about it, that they seek attention about it. Generally, men come much later in course of the problem. The veins become big, the legs become black, then ulcer starts forming. At that time they come. So men come in a more complicated status for us. So for some reason, all these reasons put together, I see a 5 to 10% more occurrence in women than men. So about 55 to 60% will be women, the rest will be men.
Can you walk me through the stages, like, what stage 1 to end of varicose veins?
Correct. So first stage, we see the small visible veins that are like threads. They're not more than 1 or 2 millimeters in size.
Are these the spider
veins? Correct.
Okay.
Now, second stage, spider veins get a little bigger. Okay, and they're also called spider veins, but there's more terms for that. So first stage is called telangiectasia. That's the English, the medical word for it. And second stage is called reticular veins, but both are spider veins only, basically, but the bigger spider veins. But stage 1 and 2, you have no symptoms, absolutely no pain, nothing. Right? Stage 2. So stage 3 is either of them, small veins or big veins. But with that you have symptoms. Legs are aching at the end of the day. Legs are swelling up at the end of the day. Small color changes coming in below the knees. And that is stage 3. Stage 4, below the knee, the leg becomes properly black. Like a black color starts coming in the legs. And stage 5 is small ulcer, like skin ruptures because of the flow abnormality. And stage 6 is big ulcer, and that's almost like gangrene that we call.
Where you have to amputate.
It's not always, but rarely, yes.
Okay.
Nowadays we can treat virtually all stages. So
the
one thing about stages is, while it is good to know, I hope nobody self-diagnoses stages for themselves. Like almost everybody in my practice comes, sir, I saw that TV show of yours. So I'm stage 1. No, you're not stage 1. Your leg is black, right? So they only tell me. So one of the things with direct approach to media, through media approach to patients is, it sort of can be, some people can misunderstand the problem. Self-diagnosis is an issue there. So they shouldn't be doing that, even if you know the stages. And the other thing is, the 1 and 2 that we never used to treat before, we can now treat with the newer techniques I have got. So if someone has little spider veins in the legs, and that's ugly or that's bothering them, or they want to have shots or something, we can cure them. And that's the second set of procedures. So we so far spoke about laser. Now we can do a new procedure called CLACS.
What's that?
So CLACS expands to cryo, laser, and cryosclerotherapy. So CLACS. Right? So what it does is, we put cold air we pump cold air onto the skin,
Mm.
sort of numb that area,
Mm.
and use micro needles and just take care of this entire veins. It's a cosmetic sort of.
Mm.
So it works very well. So we've treated. So this is second thing that I had to bring in from out of the India, because again by 2024 we have done this for 9 years. So a lot of men and women are happy with the varicose veins itself, but they keep saying, "Sir, ye fir dikh raha hai. If I've undergone the procedure, why can I see the small veins? Or my relative has the small veins only. Can we have a separate treatment for that?" So this clax had to again import from Brazil. Again, there's nowhere there in India.
Oh.
There's one unit in Dombivli, Mumbai. There's one person does it, and me. That's all. Nobody else does. Whole of India. Nobody can do clax.
So with clax coming into the picture, so the veins can't be seen.
Veins can be completely cured. Those little ones, those small ones that are causing cosmetic problem.
So even the cosmetic problem is like out of the picture.
Yeah.
With case one, it's just the treatment procedure being done, but still you can see the veins.
Correct.
So who usually comes for clax, and what's the price difference between the normal and this?
It's not different. This is Clax India. I've kept it very cheap because it's still is a process, right? India cosmetics. I mean, we are nowhere near Brazil or Europe for when it comes to cosmetic treatments. Women are very accepting. Our clothing is also longer and so on, right? So Brazil, for example, I mean, I went to the guy to see how he does. He does only cosmetic veins. He say, I kept telling, what about this ulcer patient? He says, I'll send him to government hospital. So cosmetic. So very amazing. It's a complete reversal of what I do, for instance. But I kept it very cheap. It's very cheap. It's about 10,000-15,000 types. But we kept it cheap only deliberately because we need to create awareness. But to answer the first question you asked, who comes for it? Initially, I thought some models or somebody's interested in wearing, shorter clothes would come. But exactly opposite. All regular women only are coming and saying, "Sir, you're doing this vein, but I should not be able to see this. No, if you do this, you do that also," they're saying. So very interesting. In India, always you come up with a surprise. You think X, but Y happens. I believe it's a testament of the faith we created in them that everything can be cured when you come to AVIS sort of a thing. So they're saying, no, we'll pay extra. So initially we never should tell them. They used to only ask, "Sir, what is this clax poster you put there?" Then we tell, "Madam, it's not for you." "No, why not for me?" "No, the small veins are not a problem." "No, why not? You cure it." Like that. So they were actually forcing me. So very interesting.
It's like what you said, keep it on the table, let them come and eat.
Yeah.
Don't shove it in their face.
Just told.